This is Dr. Epstein. I'm here with an unusual case today, David, who hails from North Florida. David, when he was 2 years old, he's 34 now, when he was 2 years old, he experienced a scalp burn, lost around 50% of his scalp. Between the ages of 5 and 11, he underwent at least 6 or 7 procedures, David,
Yep.
to reconstruct his scalp. And it's done a pretty good job, and basically he's got some hair coverage. What he doesn't like, and I understand this, is that he's got still a fair amount of scarring up here. And you can see along this side as well. And what he's basically has undergone is tissue expansion. On this side, he underwent tissue expansion, and they brought this tissue expanded flap forward, but it still didn't make it all the way. They also went ahead and did some type of flap, like a temporal parietal flap or a jury flap from here and rotate around, but he's got this divergent direction of hair growth. He's got some scarring still here, and lastly on this side he had some type of advancement done here as well, like this peninsula, but obviously it's not complete. What I've explained to Dave, what's really good in his situation is his donor hair is like top 10%. So he's got really good hair with which to work. We just have to figure out how we can move it from here up to here. Now what we're going to do, and we've come up with a plan, because he's got a lot of scarring here, we don't feel that the hair grafts are going to have a very good chance of growing here, plus it's scarred skin, it's never going to look good. We're going to do another cycle of tissue expansion. We're actually going to put 2 balloons in. I anticipate 2 balloons. One balloon's going to go up here. It's going to blow it up so this area is all stretched out. What that will do is it'll permit me to move this whole flap forward, cut out all the scarred tissue, and probably up to here. What we're going to do on this side is we're going to expand this area back here, even though he's got a scar there, which will stretch out a little, but at least we'll get this, and we'll bring this forward so we get this down to like here. Then over here, this will be sort of like no man's land. We'll figure out what we need to do. We have a couple of options. I am going to try to excise some of this today, and at some point, if we still need to, we can always put a small balloon expander in, but I don't anticipate we're going to want to do that. We can put a balloon expander in and bring this up, but we're going to try it without that and see if we can just serially excise it. As soon as 3-4 months later, once everything is healed up, we can then bring him back and do some hair grafting into what will now be much more normal, non-scarred scalp. Today, in addition to putting the balloon expanders in, we're going to do some hair grafting along here into this scar and up into this area, taking hair from the back. And lastly, we're going to do hair grafting. I may do some hair grafting like right into here to start giving him a sideburn, which will make a nice difference for him right into this here, because this is good tissue. Any words?
Looking forward to it.
All right, this is Dr. Epstein. Thank you.